device they're using to get the ink into the skin has to penetrate the skin, you can potentially inject some bacteria or virus into the skin and then cause a problem. So there have been certainly a number of cases of bacterial infections or viral infections, including hepatitis. And then down the road, what happens with the ink, there can also be problems. Some of those inks, some people are allergic to in this country and around the world, and they have these anything from a mild to a really massive allergic reaction to the ink that's gone into their skin, which causes burning, itching, sometimes ulceration and scarring with that. One of the other issues we've been seeing with the tattoo, particularly when people get a big tattoo like a sleeve covering a large area, is they cover a good portion of their skin. So if that patient were to develop melanoma in that area, it's very difficult for the patient to see that and for the physician to see it. There have also been cases of tattoos reacting when someone goes for an MRI, which can be an issue. Lastly, there's some question about some of these tattoo inks potentially leading to cancer down the road.
In your practice, have you seen, with the increase of the number of people who have tattoos, have you seen an increase in the number of people coming in with complications?
Yeah, we have seen an increase in the complications, but it's probably reflective of just the increase in the number of patients getting tattoos. So overall, I don't know if the percentage of people getting complications has changed. We've definitely seen an uptick over the last few years.
And talk about the ink, because as I said, it's not regulated in the United States. The EU, the European Union, has banned some ingredients. What do we know about what's in the ink in the United States?
Well, unfortunately, we know very little about what's in the ink in the United States because it isn't regulated. They can use absolutely anything. There's actually no ink that is FDA approved for injection into the skin, and I think that's the main problem. I think it would be a lot better if they were able to standardize it, get rid of, like the EU did, some of the that could potentially be harmful, and limit it to a handful of them.
And the FDA has put out proposed guidelines. Is that enough?
Yeah, I mean, I think some set of guidelines would be fine. That should be a working base to start with, and then we can go down the road. But I do think that would be very helpful to help regulate the tattoo industry.
In that Pew survey that we talked about in the introduction, about a quarter of the people who do have at least one tattoo said they regret it. How is tattoo removal? How does that work? And have you seen a lot of people coming in asking for that?
Well, sure, and that's what we see mostly. Patients coming in who do regret it, and the numbers vary from. There was one study that showed 78% that people regretted it. Some say 40. An NIH one, and one by a tattoo artist only showed 2% regretting. So the numbers vary. How we remove them is with lasers these days. We've got a lot of different lasers. The new picosecond lasers work much better than our older lasers. And I think if someone's getting a tattoo removed, make sure they go to a board-certified dermatologist who's got some of these high-tech lasers, not just some mom-and-pop shop that may have the millisecond lasers, which could actually cause some harm.
You said earlier that you tend to see the patients who have problems come in. But if a patient were to come in and say to you, I'm thinking about getting a tattoo, what would be your advice?
Yeah, I mean, I guess the same thing as I told the members, be sure you want a tattoo and know that there are some complications that can happen with it. And also know that it's going to hurt a lot more and cost a lot more to remove that tattoo than it is
I am preparing me for my presidential campaign
Dermatologic surgeon
2024.
Thomas Moore, thank you very much.
My pleasure. Thank you.